Good morning and welcome to another edition of Medical Minutes brought to you by Passavant Hospital. I am Dr. Peter Russotto, your host and moderator. Today I have in the booth with me Carrie and Tina Crawford. Our topic will be ostomies. Carrie and Tina are RNs with advanced training and are certified in wound, ostomy, and continence. Both are employed at Passavant Hospital in the Wound Center. Welcome, ladies. The first question I would like to direct to Carrie, what is an ostomy nurse?
An ostomy nurse is a specialist, registered nurse who provides care for people living with stomas or an ostomy. The nurses are certified in ostomy nursing by the Wound Ostomy Continence Certification Board, which is a national certification organization. And getting the certification takes place after completing coursework, spending time in clinicals, and then having extensive time studying, and finally by taking the national certification exam. Ostomy nurses started out actually back in 1958. There was a young woman who had ulcerative colitis, and she had an ostomy. She found that there was a great need for having this specialty of nursing, so she joined up with a colorectal surgeon, and they developed a network of ostomy specialists. And then in 1992, that network became the Wound Ostomy Continence Nurses Society that Tina and I are part of now. At Passavant, we have not only Tina and myself, but we have two other certified ostomy staff nurses, and then a certified nurse practitioner.
We've been talking about ostomy. What is an ostomy and why would an individual need an ostomy?
Well, an ostomy actually refers to the surgically created opening in the body that allows for discharge of body wastes. A stoma is the actual end of the ureter or the small or large bowel that goes out to the abdomen that you could see protruding through the abdominal wall. Some common types of ostomies are a colostomy, and that's probably the one that most people are familiar with. A colostomy is a surgically created opening of the colon or the large intestine, which results in a stoma. An ileostomy is a surgically created opening from the small intestine, and then a urostomy would be a surgically created opening that diverts urine through to the abdominal wall. And some reasons for having ostomies could be diverticulitis, cancer, inflammatory bowel disease, and the inflammatory bowel disease types would be Crohn's disease or ulcerative colitis. Some ostomies are temporary and some are permanent. The temporary ones could be if you had diverticulitis that had ruptured and then you had to have the diseased part of your bowel removed. An ostomy could be there temporarily while things heal up and then be connected back again later.
Yeah, that's called a reanastomosis, and that could be down the road 6 months, a year, 2 years later, and that's variable. What does an ostomy nurse do?
Well, an ostomy nurse does a lot of teaching, mainly. One of the first things that you may see me doing is, for an inpatient nurse role, is we might do a stoma marking, which would be having a patient come in and we look at their abdomen to see where would be the best place to have their ostomy created. And that is usually done by a certified ostomy nurse as well. I do a lot of education, a lot of hands-on of showing patients what an ostomy is, what is the normal appearance of one, how to take care of an ostomy on a day in and day out basis. We use a lot of literature for teaching, videos, hands-on. We involve a lot of support groups and support systems, like the spouse or a child or caregiver may help with helping the patient with the ostomy. We also help them to obtain appropriate supplies, meaning like the wafers and the pouches that are placed on the abdomen to be able to capture the stool or the urine that is created. And then once a patient is discharged from the hospital, then we have an outpatient program that patients can come in to, if they have any questions or if they have any troubleshooting that they need to do, whether their ostomy appliance isn't staying on appropriate for a long period of time, or they just have some questions in general.
I believe this emotional support that's given to these patients is probably very welcomed, because it's an overwhelming situation for somebody to go through the surgery, have a complete change of their lifestyle, and then there's a lot that's needed, like you said, supplies and coordination of this. So I believe you guys provide an excellent service, and the biggest thing is probably the emotional support, and let them know that they're not alone, correct?
Right. It's a huge part of what we do.
It's a little hand-holding, but it's definitely needed for these patients.
Yes.
How does a person take care of an ostomy once they have one?
Well, they have what's called a wafer, which has a sticky side to it that sticks to the abdomen, and then a pouch that kind of secures onto the wafer, kind of like reminds you of Tupperware in a way. It pouches on. They will be able to empty the pouch and clean out the pouching system. It may be anywhere from 5 to 6 times a day, or 3 to 4 times a day, just depending on what type of ostomy they have. It is changed. The wafer and the pouch are changed about every 3 to 4 days. And if you have a urostomy, which is where the urine, they may have like a nighttime drainage container, or they may wear a leg bag. But most generally, when they have a colostomy or an ileostomy, they just have to empty their pouch at bedtime, and then they're usually pretty good till they get up in the morning time.
I suppose, though, your services are not just for people who have recently undergone a need for an ostomy. It could be a patient who's been 20 years post-op, 20 months, 20 days, correct?
Right. It can be anyone who's had one, no matter how many years ago. We've had some that's had it for 8 or 10 years, and they're start to have problems. They may not have had their surgery at Passavant. They may have had it, at Memorial or some Springfield hospital or even a St. Louis hospital, and they can give us a call and we can help them to find a better product for them.
Yeah, that's a big point. I'm sure that there's some people that there's so many new products out there that they're not even aware of, but that's what you can do, is point them in the right direction, correct?
Right.
What other support is available for people with ostomies then?
Well, one of the things that we do at Passavant is we actually have our own West Central Illinois United Ostomy Associations of America support group chapter. So we meet monthly. We meet on the third Tuesday of every month at 12 noon. And we're actually in meeting room 5 at Passavant. So if you're in the community listening and you have an ostomy, or you know someone with an ostomy, everyone is welcome to come to our support group. We try to have a health-related topic at each of our meetings. We'll have guest speakers come. And then once a year, we host an ostomy vendor fair. And so, Dr. Russotto, you mentioned that there are some new products that come out that a lot of people aren't aware of. And this is a way to have different vendors come and bring those new things so that people can see them and touch them and feel them, and even get some samples sent so that they can try out different products. And then also to network with other people that have ostomies. The United Ostomy Associations of America has an excellent website. Their website is ostomy, ostomy.org, and that website has a wealth of information. Other places that you can get support would be through contacting the ostomy nurses in our department at Passavant Hospital. And our phone number is 217-479-5769. And we can provide telephone support to people and help troubleshoot whether you need to come in for an appointment or not. And then one final thing that we offer for new ostomies that are in the hospital is an ostomy visitor program, where patients that have a new ostomy can have someone experienced with an ostomy either call them on the phone to give them support or come and visit them. And that's a nice way to see a role model who is living with one and doing so very well.
Well, thanks for those numbers and website. But just to tell the listening audience, sometimes it's hard to remember numbers. If you ever wanted to get a hold of, like Carrie said, any of the ostomy nurses, just talk to the switchboard operator at Passavant and ask for the wound center. And then once the secretary answers, you can ask for an ostomy nurse, and they'll point you in the right direction. So we are accessible. They're there Monday through Friday, correct?
Yes.
And that's basically 9 to 5 or 8 to 5? Or
8 to 4:30, Monday through Friday.
So yeah, it's a service that I encourage the listeners, if you have somebody with this pathology or had a surgery, to definitely call. I thank both Tina and Carrie for coming. I'm going to throw an open-ended question. Is there anything else you want to get out to the listening audience about ostomies?
Well, one thing I could think of is that summertime usually means that we might sweat a little bit more. So if you have an ostomy and you're out there, you may need to change your ostomy appliance more often. Sometimes in the summertime you have to change it twice as often, and you also need to stay very well hydrated. Drink plenty of water and fluids if you have an ostomy, because you do lose a little bit more fluid.
Thank you. You covered a wealth of information and knowledge for our listening audience, and I thank you all for listening, and good health.